Okay,
Go
thanks,
ahead.
Christina. Thank you, Paul, for that moving presentation. I don't think I can match that. What I'm going to present on is a different view, a view of a team that joined the collaborative last year, or just over a year ago. And I'm just going to talk a little bit about our journey and how we became Positive Wellness North Island. Now, I'm the manager for chronic disease management and nutrition therapy, so I have a bit of a manager's lens, and I'm just going to talk about my observations. So next slide, Christina. Okay, so at Northern Vancouver Island, we have a lot of benefits, and we have a lot of challenges with our location. It's vast, it's beautiful, it's wild, and it's remote. And we started as North Island Liver Services, which is a bit different. We were a viral hepatitis program joining an HIV collaborative. Next slide. So if you look at the red line on the top red line that goes up into the green and the purple site, that's actually our catchment area. So it was a very large area, and we were providing hepatitis C services. What was happening, we started in 2002 with North Island Liver Services, but people were coming to our viral hepatitis program asking for HIV care. Now, we knew we couldn't do this alone. Next slide. So if we were going to be successful, we realized that we had to partner. And one of the partners that we needed to make was with AIDS Vancouver Island, North Island. So where did we start? Well, there was no North Island HIV program, but what we did have was a variety of dedicated healthcare workers, community workers, AIDS service organizations working independently and providing siloed care. What we wanted to do was attempt to create an integrated team that contained Island Health staff and AIDS Vancouver Island staff, but when we joined the collaborative, we weren't a team. We had resistance from staff to use quality improvement languages and approaches, but this team actually, both teams, were doing quality improvement. They just didn't know the language. Next slide. So we came to for our first meeting in Vancouver, and we decided that there was really strong aspirations for improvement. And what we wanted to do was create an integrated HIV team. We decided we wanted to complete a comprehensive needs assessment and develop a referral pathway and partner. Next slide. So the question came, how do you remove silos, or at least create a pathway between them? Well, we had some good experience with our hepatitis team. Next slide. And we knew that we could break down the silos and partner. Oh, you can go to the next slide. And we had a motto where every door is the right door to access care. We believed in creating documents, ideas, and models and giving them away. And that was what our hepatitis C success was based on. Next slide. So we came with actually a strong background in hepatitis C. We knew that individuals that were accessing our services were struggling with mental health issues, medical issues, social issues, addiction issues. They were struggling with stigma and poverty, and we had worked out ways to help people move forward and access treatment or improve their life situation. So we felt confident in the hepatitis C world. Next slide. We had a model that was person-centered. It was based on respect, trust, and relationship. And the question that we had was, how do you apply this to the HIV world? Next slide. We knew that our model worked in the hepatitis C world. We've done a number of research posters, and we actually looked at our results in hepatitis C treatment compared to the approach study. Now, the approach study looked at academic centers and community health centers. We wanted to see, were we doing as good of a job? And in fact, in some areas, we were doing a better job. And one of the areas was not losing people to follow-up. Our treatment outcomes were good. We had 75% of our Hep C clients on treatment, complete treatment, compared to 52 and 38%. So we knew we were on the right track. Next slide. We also knew that our treatment outcomes were actually excellent. When we looked at all patients, we had a 56% success rate in clearing the virus. And in genotype 2 and 3, we had 76.6%. So we were doing okay. Next slide. So what were the issues? Issues related to HIV diagnosis? Well, the folks that we were meeting had mental health issues, maybe. Maybe there were some medical issues, social issues. Once again, stigma strong, poverty, addiction issues. And we realized that maybe our model would work, but we really needed to partner. Next slide. So during the STOP HIV Collaborative, the team members described the process as being put through mental gymnastics and described Christina as being the Weight Watchers task manager of quality improvement. Sorry, Christina, I couldn't let you off. But through this process and through the resistance, the gang was becoming a stronger team, and they really were becoming a team. Next slide. So after we completed a needs assessment, that completed chart audits, we did surveys that involved physicians, community agencies, and clients. We had a really high participation rate with the physicians. They said they wanted an HIV specialist to come to the northern end of the island, and that happened. They said that they wanted some education, and we were able to provide it. We created an internal and external referral system, consent form, pamphlets, and we defined agency roles. And at the bottom there is an exercise that we did, just looking at the timeline of HIV over the last decade or so. Next slide. So what we became North Island Positive Wellness, and we created a pamphlet. So North Island HIV Services is a team, and it truly is a team of healthcare professionals working in association with their family physician, nurse practitioner, and HIV specialists. We provide integrated service of prevention, education, and treatment and support related to HIV. Next slide. Our major accomplishments, well, we completed all our aims in really a very short time. We used a thoughtful, holistic approach, and we really became a team. And we actually have integrated HIV services for the North Island. Next slide. So today, our team values using the QI approach and continues to do so. We're using the language of quality improvement without even thinking about it. We credit the collaborative for our success. Our QI journey continues, and I'm proud to say that this team is a high-functioning team. Next slide. That's it.
Thank you, Pauline. Thanks.
Pauline.